I'm a licensed insurance agent, appointed with over 40 different insurance carriers and licensed in 25 different states to sell insurance. In today's video, I want to talk about the difference between Medicare for All and our current healthcare system. Now, because our current system is so vast and complicated, I could literally spend hours discussing everything that's wrong with it. But today, we're just going to focus on the most important flaws, and I'm sure by the end of this video, you'll be able to understand why Medicare for All is going to be the best option for everyone in the country moving forward. All right, well, let's get started. So Medicare for All is going to be a universal public healthcare system. So what that basically means is that everyone in the U.S. would have healthcare. They'd have the same healthcare regardless of age, income, and even pre-existing conditions. Now, with Medicare for All, there's going to be a single payer, single provider model. What that means is that the government is going to provide your healthcare, and the government's also going to pay for it. Our current healthcare system has 4 different models. Now, it also has a single payer, single provider. It has single payer, multi-providers. An example of that would be Medicare Part B. No, actually Medicare Part A for most people. I say most people because you have to work about 10 years full-time for Social Security to pay for your Part A. It also has multi-payer, multi-providers. An example of that would be employers' plans. You know, with an employer plan, the employee pays for part of it and the employer pays for part of it. And then our last plan is not really a plan at all, it's just self-pay. Basically, people who don't have insurance, about 28 million in the US. So with our current system, we actually have 2 different sectors. We have public and private plans. Now, with the private insurance, we currently have over 900 for-profit health insurance companies within the US. They provide employer plans, short-term medical, dental, and vision, things like that. But they also have a hand in our public plans as well. They do provide Medicare plans, and they also have Affordable Care Act plans. The Affordable Care Act plans are provided on a public exchange, so they are available to the public, but private, for-profit insurance companies do provide those plans. Now, this might not seem very important, but I just want you to think for a moment of all the claim processing, billing, and coordination of benefits that 4 different models in one system would entail. So I want to back up a bit and talk about Medicare and Medicaid and explain the difference between those. A lot of people get them confused. Medicare is provided by the federal government. Now, that is for people that are 65 or older or must be on disability for at least 24 months, or you have end-stage renal disease or Lou Gehrig's disease. Now, Medicaid is offered by the states, and it honestly varies by state on who can get it. Generally speaking, it's going to be low-income, pregnant women and children from low-income homes. CHIP is going to be the program for Medicaid for kids, and then PACE is going to be for elderly people of low income. So elderly people can have Medicaid and Medicare at the same time. It's called dual eligible. I'm not going to get into that today, but I just wanted to explain the difference between these 2 before I go on my Affordable Care Act rant. Now, let's talk about the Affordable Care Act. The Affordable Care Act has also been referred to as Obamacare. To a lesser extent, Trump Care. It's not a real thing. There's no such thing as Trump Care. Some insurance companies market the Affordable Care Act, ACA plans, as Trump Care. If you really want to call something Trump Care, I guess you could call short-term medical plans that deny people for pre-existing conditions. I guess they could be called Trump Care. But there's no such thing as Trump Care. Okay, so moving on. Now, when the Affordable Care Act first came out, it was intended to be this great solution to our country's healthcare crisis. However, when bills get passed, sometimes you have to make changes to get them passed. So with those changes came some unintended consequences that created some pretty significant flaws within the system. So the biggest flaw with the Affordable Care Act is that when it originally came to Congress, it was to say, okay, well, the states are all going to expand Medicaid, and anyone that is 138% to federal poverty level or over, the Affordable Care Act is going to step in and, take care of them. Now, Congress came back and said, wait a second, you can't force the states to expand their Medicaid programs. So they had to make that change. And they said, okay, well, if the states expand, for the states that are expanded, we will cover the people who make 138% to federal poverty level. And the states that are non-expanded, we will cover anybody that is 100% to the federal poverty level and over. Seems like the perfect solution, right? Well, you'd be wrong, because what it did was actually created a thing called the Medicaid gap. Now, like I said, with the states, they could choose if they wanted to expand their Medicaid or not. Some of those non-expanded states, they also get to choose the income requirements to be eligible for their Medicaid. Now, as the federal government set that limit at 100% to federal poverty level, these states can actually set the income requirements much lower than 100%. So if you're a childless adult and you make less than 100% to the federal poverty level, and you needed an ACA plan because you needed insurance and you didn't qualify for your state because you made too much of whatever it was, say they set it at 40% for a childless adult. So say you made $7,000 a year. You make too much for Medicaid, not enough for the Affordable Care Act plan. That means you have to pay full price for an Affordable Care Act plan. You wouldn't qualify for those subsidies because the federal government says, well, your state didn't expand it, so we're not going to pay for it because they're supposed to pay for it. A full price plan of the Affordable Care Act for somebody, say you're 37 in Florida with no subsidies, full price, it runs about $495 for an okay silver plan. Pretty crazy, right? Okay, I'm going to give you one more example that has to do with the Medicaid gap. So imagine you're an adult in St. Louis and you're not working because you're too sick, you have cancer. Well, your state isn't going to cover you. It's not going to give you health insurance. And that's right, you'd have to pay full price for an Affordable Care Act plan. An Affordable Care Act plan in St. Louis for a 37-year-old that doesn't have any kids is going to be $389. So you make zero because you can't work, you're too sick. And you'd have to pay $389 a month for insurance because you wouldn't qualify again for those federal subsidies. Now, if you can possibly get on disability for 24 months, you might eventually be able to get on Medicare if you live that long. But other than that, you're just shit out of luck. Okay, so let's walk through one more scenario that highlights some of the major flaws of the Affordable Care Act plan. Let's say that you have a family of 4 and you make about $50,000 a year. Now, your employer does offer coverage, but it's $2,000 a month and you just can't swing it. You have rent, you have all those other expenses every month, $2,000 a month for 4 people. You just can't afford it. Now, technically, you do fall under the income and household size for federal subsidies. However, because your employer offers coverage, you're not eligible for subsidies. That's right, you'd have to pay full price for an Affordable Care Act plan, unless your plan cost more than 9.78% of your salary. Well, that's great because it's $2,000 a month. But wait, that only applies to people if you're only counting one person. So what that basically means is you would have to figure out how much it would be for just yourself, not your family. And if that's more than that 9.78%, then it's considered unaffordable. A full price plan in Missouri for a family of 4, the Affordable Care Act plan would be $1,295 a month for an okay silver plan. Not very affordable. Okay, so because we're running a little bit longer than what I originally intended, we're just going to touch on the employer and short-term medical plans. We've already pretty much touched on the employer plans and how expensive they can get once you start adding spouses and children. Short-term medical plans, they would be great for someone that's super healthy, never goes to the doctor, never has any chance of getting hurt, anything like that. No pre-existing conditions. They won't take people, they're underwritten, so if you have certain pre-existing conditions, They would decline you. They don't have to take you like the Affordable Care Act planned or an ACA compliant employer plan. Also, if you have pre-existing conditions that are able to pass the underwriting, they don't necessarily have to cover anything associated with your pre-existing conditions. All right, so let's talk about some prescription drug costs. Now, it's kind of hard to get the specifics because of all these different plans. You know, we have over 900 companies here, employer plans, all of this stuff, you know, thousands of formularies, thousands of different drugs that have different tiers on different plans. So we're going to talk about the one consistent, which is going to be the Medicare. Now, with our Medicare Part D for 2020, the true out-of-pocket cost, which they also call TROOP, for 2020, if you don't have any financial assistance and you don't have any supplements, things like that, you're going to be paying $6,350 for 2020. Now, 2021, it's probably going to go up because it goes up every year. But for 2020, the most that you would pay for your drugs would be $6,350. So under Medicare for All, your cap for your prescriptions will be $200 a year, which means whatever prescriptions you have, the most you would pay for your year would be $200. For your premium, your max out of pocket, your deductible, you're going to pay $0 out of pocket. You're going to pay a portion of your taxes is of course going to go to it, but I mean, you're paying taxes now. And what are you getting out of it? Look, I know what you're thinking. Well, Stacy, you have these crappy graphics and you kind of explained it okay, but how do you plan on us paying for Medicare for All? Well, what if I told you that all this, with all these third parties and these 900 companies with their administration fees, is currently costing the U.S. 17% of our GDP. Plans similar to Medicare for All in other countries, Canada, it's costing them 10.2% of their GDP, the UK, 10.5%, and Germany, around 11%. Now, you might have a really sweet employer plan. You might not have to worry about this because you're healthy, but if it doesn't even pertain to you and you don't care about any of your other fellow Americans suffering and dying because they don't have insurance, you gotta care about the economy. 17%. Other countries, anywhere from 10 to 11%. We can pay for this. We can't afford not to. All right, just a quick recap. Now, with our system the way it is, there are still 28 million people that are uninsured. 3 million of those people are not eligible for an Affordable Care Act subsidy, so they'd have to pay full price. 2.5 million of those people are in the Medicaid gap, which means they make too little money to get any subsidies for the Affordable Care Act, and their state won't cover them. 80% of those people live in the South, from Texas to Florida. 80% of those people in the Medicaid gap live in the South. This year, over 500,000 people are going to file for bankruptcy because of medical expenses. And this whole plan, this broken system that we have, cost our country 17% of our GDP. This plan is going to cover everyone. You're going to have to pay $0 at time of service. You're going to have to pay $200 at the most for your prescription drugs. And it's going to cost anywhere from 10% to 11% of our GDP. So I'd like to take this time and thank you for watching my video. I wanted to go over the employer plans and short-term medical and networks and what they are and billing and all that good stuff. Just not much time. So I'll do it in a video later on. My next video, I think I'm going to go over the taxes a little more in length on how we're going to pay for Medicare for All. Like I said, thank you for watching. It's my first video. I'm not very tech savvy. I mean, obviously. This subject's very close to my heart. Like I said, I'm a licensed agent. And I've been on the phone with a lot of people that are crying, that are hurting. Hearing a grown man cry because he's dying and he can't get insurance because he lives in a non-Medicaid expanded state it's gut-wrenching, and it really changed me. It changed the way I looked at things, and we have to do better. Just because you're doing good, or just because it doesn't affect you, we have to take care of each other, and we have to do better.